Okay. All right. Welcome, Dr. Kayte, to the Biohacker Babes. Thanks so much for joining us.
Thank you so much for having me. We've been planning this for feels like forever now. So I'm happy.
I know. Yeah. We got connected, or I guess the beginning of this year. For anyone that remembers me talking about this fabulous event called Biohack Your Beauty, it was back in March in the LA area. Dr. Kayte is the mastermind behind that event. It was super cool because you brought together such a unique group. Like I had never been to a conference where we had biohackers, plastic surgeons, regenerative medicine doctors,
Mhm.
functional medicine doctors. So it was like a really cool blend of people all focused on biohacking your beauty. So you are quite the expert in this field. So we're so excited to bring you to our audience. But in general, like we definitely want to give away some tools and tips for biohacking your beauty, but we really want to focus on something that you know a ton about, and that is breast implant illness and just breast implants in general. So for anyone that's listening, maybe you have them, maybe you want them out. Maybe you're thinking about getting them. Maybe you know someone that has them and is struggling with health issues. I just think this is such an important topic that not enough people are talking about. So, one, thank you for bringing the awareness to this.
Yeah.
And two, I think let's start with your personal story. I think it's really powerful for people to hear that. So, let's jump in there.
Yeah. Well, thank you for coming to Biohack Your Beauty. And you represented biohacking women and hosted an amazing panel. So that was so fun. And yes,
Yeah.
the entire movement around beauty biohacking came through my own struggle with breast implant illness and also having a shift in my perception of judgment around augmentation and body modification. So I spent a long time being part of the explant movement, and I still am an advocate for explant, but I also encountered so many women that were in different stages of their journey with breast implants and with augmentation in general. And I started to form a different perspective on how to support those people and just not feeling so strident about the need to remove, because I actually like encountered people who is that text in the sound? Can you hear it?
Yeah.
You guys?
Yeah.
Yeah.
I
Is
don't
that
know
your
how to
phone
turn it
or is
off.
that computer?
It's my laptop, but I don't know how to turn it off. I'm sorry. I don't know
Huh.
if I mute it, it's gonna mute me. I'm so sorry. This has
What if
been a
you turn, I was going to say, if you turn off your phone? I don't know. Lauren, do you know how to do it?
oh
Because you know, you,
yeah. Oh
Yeah, I think
no.
if you do not disturb on your phone, because it's coming through
Oh,
like
okay. I
iMessaging.
think
Is
I
that
think
what it is?
I'll try that. I think the laptop
Yeah.
has like its own settings, but let me see if I can do that. Do not
okay,
disturb.
That
Okay.
always works for me. If my phones do not disturb, then the
okay.
The
computer
Yeah,
does.
I
laptop on
haven't
here.
connected my phone, so I'm like, I'm not tech savvy enough.
Thank you
Yeah,
guys.
we'll edit this out. No
Okay,
worries.
okay. So where were we? We were saying I don't know
Just
where.
like not being
Not
super
being so
strict.
strident. Mhm.
Yeah.
I don't know.
Yeah. Well,
Yeah.
I think I really appreciate that you have that approach, because I have met some women that are like, I can't believe you have those. How are you a healthy person, a health practitioner? Like, I feel like there's a lot of judgment around that. So I
Yeah,
appreciate that you're like open to the idea that some of us want to keep it. And like, so personally, I do have them. I'll be honest with that. And there's kind of a lot of trauma, I would say, around like the want for them. And I don't know, maybe I need to do a mushroom journey before I get them out. But like, I, I, I remember some nasty comments when I was a teenager because I had no boobs.
oh,
Like, I mean, I have photographic memory of overhearing people say, like, "Oh my gosh, she's so flat," blah 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 blah. Um, and I really remember that. So for me, getting implants, it really helped with my confidence. I
yeah.
started standing up straighter. I felt like I could dress nicer. Um, yeah. So I mean, that's a whole rabbit hole there, but
No,
it's a thing.
that's super interesting. And it reminds me, I was bullied for having a small butt in high school. Actually, I think middle school, I was very skinny. And for whatever reason, the culture where I grew up was more like skewing towards being curvy. And so it was strange. And it really wasn't, it was really just one person. But, anyways, when we're young, sometimes we have these experiences that burn into our long term memory, like what you just described. And it created this opening in my brain where all I wanted was to grow my glutes. And I just I couldn't when I was young and in wrestling. We were also cutting weight. I was a wrestler. And when I got to college, I remember all of a sudden my glutes grew magically. And I thought that I manifested it and I didn't understand what that meant. And then flash forward where we are now, I understand the way neural integration in the brain works. And really, anytime you focus on an area, you're creating a pathway and you're creating an opening to that area. So, and similarly, if I were to have gone the opposite way and I had shut off my brain from my glutes because I felt so bad or inadequate and I just didn't, I wanted to wall it off from my consciousness, there's an opposite effect where you're almost down regulating like nerve and blood and innervation, and then the muscle pattern can get skewed. So it's interesting. So it could go both ways. And then when you biohack an area of your body, you have an opportunity to create a new relationship with that area. So even though the breast implants that you put in your body do have toxic chemicals and they might not be the healthiest thing, and because it's a foreign object, there might be an effect on the chi, like the flow through those meridians. All that being said, because you frame it in your consciousness as a positive and you frame it as an opening, I think that the hierarchy of how things trickle, it's like spiritual, emotional, spiritual, energetic, emotional, and then physical. So by the time you get down to the physical, you've already overrode that pathway by using it as a vehicle for expansion of your empowerment, which is way higher up than just being in the cell tissue, right? And whatever interference. Yeah. So
yeah. Thank you for introducing that. I think to have a holistic conversation about this is important because everyone's going to have their own relationship to this area of health. And I too have implants, and it's very similar story to Renee. There were bullies, and do you remember that store, Spencer's Gifts?
Yeah. Yeah. I think it still exists.
I remember the one person bought me this little candy bottle that said itty bitty titties. And like, you don't forget these things.
Oh my gosh. I know. I remember that bottle. Yeah.
Yeah. It just was such a blow, because you're being told that in these formative years, like something's wrong with you. And you don't really have a full understanding of that, but it's imprinted. And so similarly, it's like really felt so much more confident and in my body and more like a woman when I got them. Had I known all of the risk factors to our health at the time that I got them, I'm 99% sure that I would not have gotten them.
Yeah. But you haven't had those health problems, right? You're not having health problems.
I'm not having severe health issues, but we talk a lot on the show, like how much better could we feel? And we are really big into prevention.
Yeah.
So may we never know what we are preventing. And I feel like I don't always lead with, I don't tell a lot of, some people know, but I don't lead, especially in the podcast about it, because it is my own health journey. But I feel like I have to make sure I do everything else really right, because I know that there is a foreign material in my body. And I know that our physiological bucket can get quite full. And if I don't account for all the other things, this could be the thing that spills the bucket over. So I'm very aware of that.
Yeah, I would say probably like at this point where you are, that's not the situation, because you remember, so when you first put an implant in your body, your body has to create a capsule of scar tissue around it. And usually like young, healthy women and there's ways where you can turn on an autoimmune process, which has nothing to do with the capsule. But if you don't have an autoimmune process happening, which is usually genetically mitigated, if you make good scar tissue capsule and then you remain healthy with implants, you're probably not going to have the same like health issues I had. Now, if you were to now go switch your set of implants, that's another story, because now you're older. The typical way they remove an implant is they just pull it out of that scar tissue. They cut into the scar tissue capsule so they can make a small incision. And then that capsule opens inside of the pocket. And then the implant gets pulled out. And then the scar tissue is left behind and it's open like Pandora's box. So whatever it had been walling off is now like, a big load at once, kind of like when you remove a mercury filling incorrectly. Then they put a new implant in, and now your body has to make a new capsule of collagen. And then if it doesn't do a great job with that capsule, that's when potentially the immune system can get into the implant and pull off tiny pieces of microsilicone. And like usually we're seeing people have illness when silicone is leaving the capsule. So in some of the studies, we can see it very clearly, like if there was a rupture or there's silicone in the nodes or it's moved. But then there's also a big issue with what they call gel bleed, which is microsilicone. Very microscopic. The immune system is able to penetrate that scar tissue capsule, pull off tiny pieces and like, engulf it, phagocyze it. And then those white blood cells start going into the lymphatic system. So then some people are still okay. Some people, if they have aggressive liposuction, like across the abdomen or other regions, they might have scar tissue compressing those lymphatic systems. So when you start mobilizing a lot of microsilicone into the lymph system and then you have scar tissue compressing it, right? It's just common to see liposuction or fat transfer procedures in breast implant patients. A lot of people are doing different things, right? Together. So these are all like factors to consider. If you're thinking, does the person have symptoms of illness? Where is the challenge in their detox pathway, right? So there's many, you could draw like a chart and you could say, okay, when is microsilicone mobilized? If yes, then it's like, then what's next? Do they have scar tissue? Did they have liposuction? Do they have genetic mutations on enzymes that help with detox? What is their other toxic burdens? What is their age? You could go on and on and on. And then separately, we'd look at, do they have an autoimmune reaction, which these things can happen simultaneously or separately. And then with saline, it's a little bit different conversation because there are rare instances where pathogens can infiltrate the valve of a saline implant. So obviously if you have a pathogenic like infiltration of your implant, there's going to be a lot of consequences. And then it also becomes a question of who makes good scar tissue capsule and who doesn't and why. And that's we can go there later.
So I want to know about that, but I'm curious, are saline implants still being used?
Yeah, absolutely. But the saline implants do have a more robust, I believe, double pane silicone shell now. So it's a different shell than the older ones that were on the market when silicone gel was off the market. We used saline, and I have seen less problems with those. I've seen more problems with the newer ones when it comes to an autoimmune reaction. So I've had patients who
is that like the gummy bear implants?
No, the gummy bear is silicone filled gel.
Okay.
Yeah. Well,
you're saying the newer saline.
I've seen more complex atypical autoimmune reactions.
Okay. But because there's multiple materials in there?
You don't know why. It could have to do with how our species is degrading and our ability to like collaborate with foreign, or it could be related to the formulation. I don't have access to like really know the proprietary. It's not easy to get that information, but I do have a theory that the newer, like the gummy bear you mentioned, so when silicone was reformulated to be put back on the market, the main issue the company was correcting for was cohesiveness, because in the lawsuit in the 90s, the implants were just breaking apart and they were going down the ribs. And those women back then, a lot of them were sick. They had pain syndromes and autoimmune diseases and such, but the class action lawsuit did not have to prove illness in order to get them removed from the market. They just had to prove that they weren't operating as intended per the device. So it's easy to remove them. And then they weren't available from around the early 90s to 2006. And the new formulation, I don't know if you remember the marketing campaigns, but they were really focused on how they won't break. Like you can run them over with a car, you can stab them.
Yes, I do remember that.
Yes, I heard that.
The formulation was clearly correcting for the issue of cohesiveness. And it's just logical to assume, this is just my hypothesis, but my assumption is that more chemicals were probably used to make them more cohesive.
Yeah, that would make sense. Yeah. Question about like the heavy metal toxicity. Where is that coming in? Something in the implant has it naturally?
Breast implants do have heavy metals as part of their ingredients. It's not a lot.
Why?
It's a great question. It's something no one's ever asked me that question.
That's okay. You don't have the answer.
It doesn't make sense to know.
When I got sick and I didn't know why, and I was searching, I did think about implants at one point, and then like I thought that silicone is a derivative of sand, and I just never even thought about them again because I never assumed that they would have heavy metals and toxic chemicals. I found that out later, but it was interesting because I remember. But in any event, the heavy metal relationship to breast implant illness is actually more like if the patient already has a heavy metal load and burden. Mercury toxicity specifically can play a really big role in the derangement of minerals and also in the derangement of methylation and other important detox factors. So if a patient already has that, that can contribute to why implants are, like you described earlier, the tipping point event for that patient. So as they can with many things, right?
Yeah. What, so it's mercury, what else? Lead?
Lead is a big one. Yeah, lead can
Lead.
definitely cause similar issues. I mean, if you think about the periodic table and which metals are the heaviest and which ones have the ability to remain in tissue the longest and wreak havoc on the long-term health. So, and like the way your body's functioning systemically in the long term. And mercury also has a relationship to pathogens. Mercury has a relation, but lead to some extent. Mercury has a relationship to laxity in tissue, which can be a problem when we're trying to build good scar tissue capsule around the breast implant. So all of these things are at play in a more complex network of systemic health.
Okay.
So how do we look at these things to know if they've ruptured or if there's a gel bleed? Like what kind of technology do we have at this point?
Well, you can sometimes see ruptures if they're severe. You can see them on imaging. Gel bleed is not something that you know until you take out the implant and then you see if it's sticky. It'll literally be sticky. And then you can clean it and then in a few days it'll be sticky again. So yeah, and I mean to very spectrum. So you can also see them where they're like really sticky, like goo. Like sometimes they rupture inside of their capsule. That's why when it comes to the explant community, when women are sick and they have clear illness and challenge, we're advocating for a certain type of removal where the capsule is removed as a unit with the implant, which historically surgeons don't like to do. There's been a lot of controversy between the aesthetic community and the explant community on asking for that type of procedure. And I could weigh in on what I think the reasons are, but it's like it varies, right? Sometimes there is a good case where the surgeon is arguably trying to consider like life-saving important things like related to the safety. And sometimes that capsule tissue is adhered to the rib cage or it's too close to like the lung pleura, and it can become like you need a super advanced skilled surgeon to really do it. And then other instances they're like, well, this is just unnecessary and it's overkill. But again, if you suspect a rupture, you don't want to open that capsule inside the pocket. You don't want to spill more silicone. But there's it's like getting everyone on the same page to acknowledge that moving silicone is bad also, right? Some surgeons say that they have a power wash technique. I heard that, which is basically like a water, like they spray, they're like, we clean it. And then I remember when I first learned that, I just thought, that doesn't sound like it would work. How do you power wash out silicone, which is sticky? And then I spoke with other surgeons who agreed with me. So I felt validated in my person.
Yeah.
So
it kind of sounds similar. There's a lot of comparison actually to biological dentistry here.
100%,
but like I'm thinking about like when you have a tooth extracted or a root canal tooth extracted, the average dentist is not going to take out the periodontal ligament because they just think like, why bother? That's an extra step. But any biological dentist knows you have to do that because you'll cause more problems. So that sounds similar to that. And so maybe explant surgeons in 5-10 years will all be on that page.
Well, yeah, or even like the idea of walling off a mercury amalgam when they're removing that is also a similar concept.
Right. Yeah, so you don't cause more harm.
Yeah, and dentistry is an interesting topic too. I think it's interesting how the FDA is right now like in a disagreement with the American Dental Association over their recommendations around mercury. It's very interesting where we are. Yes, there are now explant surgeons, like lots of them who are specialized, who are willing to do this. But what I've seen in my journey through the movement is that it's all changed quickly. And in the early days, there were a lot of people that were trying to not like make it harder. I don't know. I guess it's pointless to go into because we're in a better place now. Thankfully, we're in a better place with this.
Yeah.
But it's because of advocacy and podcasts like this, and you can't really contain information the way you used to, which is good for the public.
Definitely.
So if there aren't any known risk factors like it being stuck to your rib cage or the other things you mentioned, is the ideal situation to do an en bloc? And can you explain?
Well, you have to consider like a lot of factors depending on the situation. And some of those factors might be costs, because finding an en bloc surgeon, it might be a more expensive procedure. If it's unnecessary, like insofar as the patient is healthy, and you remember to do the en bloc, they're going around and they have to detach that scar tissue in a, complete 360 way from the fat and the parts where it might be. And it just might not be necessary in every situation, because they can still just remove that scar tissue after. So maybe like it doesn't happen in this perfect way. I mean, this is like a really hard one for me. Like if I had my way, I would say, yeah, do an en bloc for sure. I have had surgeons argue the opposite case enough to me where I saw where they were coming from. And I really think that it depends on the situation with the patient because, right. However, my background in complex chronic illness, I would definitely say I would never want to leave behind a bunch of scar tissue. So getting it out as a unit, you could argue pros and cons for that and reasons why. And then just the argument of whether or not we leave behind the capsule tissue, which is another controversy, because surgeons maybe previously think it helps with volume, but from a complex chronic illness and immunological standpoint, I would argue that that's an immune burden. And I wouldn't want to leave the scar tissue capsule.
Okay. This sounds even more confusing than biological dentistry. I know there's, debate in the community, but biological dentists seem to all be on the same page of like, we got to remove the ligament, we got to clean the area using laser, ozone. We're putting compatible materials back in the body. Yeah. This is kind of scary. That's like, we still can't all agree on.
Well, there's not a lot of long-term safety data around something like breast implants. There really isn't. There's a long history of drama all across. And they didn't even finish their 10-year studies when they resubmitted in 2005. So the FDA in 2021 mandated the manufacturers to finish their 10-year studies. So supposedly they're doing them now. So you're like, oh
my gosh.
The data on the implants both of you have is like a 3-year data set. So yes, any device you put in your body is much more complicated to remove than to put in. That's across the board with all devices. There's like a history of problems with a lot of devices.
Well, I'm actually, I have 2 titanium dental implants that I'm hopefully getting actually out in November. I've had them since 2003. It's been a long time. And the only reason they are titanium is because zirconia wasn't in the United States back then. It didn't exist. And so our dad, who's a dentist, he's like, it's not going to be an easy surgery because it's integrated into the bone versus putting them in. It's like not a big deal, but getting them out. So I would imagine getting breast implants, all of that is harder. And I've talked to some friends that are looking into it as well. And they're for breast explant, and the price range I'm seeing or hearing from $8,000 to $40,000, which is even $8,000 is more than I spent getting them in.
Exactly. Yeah. When I removed my implants, I think it was around 7,000, but the prices have gone up a lot for some reason.
The 40,000. I'm sure he just
40 is probably because they're including a proprietary reconstruction with a lift, and that's going to vary on the surgeon, because if you look at facelifts and things like that, if you're a celebrity surgeon who has a big following and you're in demand, you can charge $100,000 for a facelift. So there becomes like a certain point where they're going to switch from like, okay, this is a health outcome related, because plastic surgeons are not in the business of like preserving health outcomes. So this is also a confusing thing that's happening. I mean, some of them are, because they're trained medical doctors. So if they want to maintain their understanding of internal medicine, I even know plastic surgeons who screen before they give implants to women, and they try to account for potential problems and say, don't do it if you have these immune issues. But that's not like the norm. That's not really the norm. And it's not really, they were never supposed to do that. Like when they specialized in plastic surgery, they were basically saying, I'm not going to be responsible for illnesses. Like I'm not working in that side of health. So anyways, but to your point, earlier, I just the reason I don't love this topic anymore, even though I can talk about it in my sleep, right? Because I'm I've become such an expert in this space, but I don't like the negativity around it. I don't like the fact that I'm telling you these things that's stressing you out and you're feeling more confused than you would have been before. And so,
I know I'm positive. I'm good.
but this isn't your first.
Well, I'm trying to maintain the perspective of anyone that could be listening, the general
100%.
public.
No, but so it's important to so it's important to discuss. So, and Renee, we've talked about this before. And so we don't know if your first time hearing it, you might've stood up. And I've had patients in front of me where they're clearly having all these autoimmune processes and I'm telling them they need to remove their implants and then they just hate me and they never want to talk to me again. And they're blinders.
Avoid, fingers in the ears.
And then they go complain to other people about I've gone through everything on this topic. And I have a very different perspective now. And that perspective it's a spiritual perspective. And it states that anything that we have in our path that happens is coming from our creator and that it's good. It's for our highest good. So I don't want anyone to be overwhelmed. If you have to go through this process and feel like a victim about it or feel, because you could very easily feel that way because it is some sort of unfair that we didn't have informed consent, but that's all changing. And I really believe it can be a pathway to a better version of yourself in so many ways. What you guys both did where you biohacked your chest, it was an area where you were harboring chronic insecurity. You took an empowered decision. You did an augmentation. I'm assuming you both love your body now. I don't like that you have guilt or feel like you have to hide it from the biohacker community. I don't like that is our space, that we have these perceptions, which is why Biohack Your Beauty space. And there was already I had people people coming from outside of LA and saying, oh, everyone has their lips done here and kind of judging from the holistic community. I'm like, okay, guy, that's not why we came all together. We came together, we could embrace, and we can talk about the history of body modification later and all of the things that means. But the point is just that in my case, I didn't have insecurity about my chest. Okay. That was not why I got breast implants. I got breast implants because I was just bored. And I was I don't know. It was so weird.
Yeah.
It was the weirdest thing. And I look back and I have no idea why it even happened. And you see how this event shaped my entire career. It's the reason I became a doctor. It's the reason I developed a stronger faith and spiritual, all of this, everything. It was so
all part of the journey.
Yeah. So
part of the journey.
So if I had looked back with regret or anger or pain, I would have just stayed in that longer and longer and longer until I was ready to let that go and transform it. So ultimately, all of the negativity ended up being a vehicle for positivity. And in your cases, it was directly that way. So there's many different ways around this. And for some people, they have surgery, fails, and then they have to redo it and redo it and redo it. Every time it's when are you going to collaborate with yourself and become expanded and empowered through this process? And what kind of trauma is also in those nerve ganglion associated with your heart center? That's another one. So.
Yeah. I really appreciate your perspective. I think that's really important. Mindset is always the top for health.
Mindset right.
Yeah. Well, I'll throw some humor into this real quick. My husband and I, we've been talking a lot about this lately. And of course he doesn't want me to get my implants out. He's a guy. So I'm okay, well, if I'm going to keep them, I got to take Dr. Kayte supplement. I got to, focus on sleep. I got to do all the things. Right. And so we have this saying, #save the boobies. So anytime I'm doing a new biohack, #save the boobies.
Yeah. Did you come up with that or did you? I'm just
curious. He came up with it.
I have a lot of male business mentors for this company, and one of them was got boobs and thought that was hilarious. And there's all these funny terminologies that no women ever would think, but men love to be boobies, boobs. I don't know what
it's just innate. It's innate for them.
I feel if I put boobs in my marketing campaigns, that would alienate every woman. But
you'd get all the men buying it. I don't know.
Yeah, hard to say. But oh man, I had a thought.
Sorry, I didn't mean to jump.
No, we can talk about this
so good. We need to just cut the air. It was really good. This really is a personal conversation, and I really love your perspective a lot. I guess I'm just curious. I want to take a step back for anyone that's thinking like, oh, how do I know if this is a problem? Like what kind of symptoms or illnesses could be popping up in this case for some people?
Or
Yeah.
lab tests, maybe.
Um, well, there are not really lab tests that are just like, oh, you have breast implant illness. As much as like we want breast implant illness to be one thing, it's really a lot of things and it's layers. And it's funny how the FDA there's a designation now, like an ICD designation for breast implant illness, but I feel like they did that 100% just from public pressure. And it really, there's so many things, but I would say the most common when you think about symptoms related to toxicity or inflammation, those are a lot of what people experience. And they can also have like a bad epigenetic expression of whatever they are predisposed to. So if it's something that maybe wouldn't have manifested into their system until they're older, it might happen younger. And that also makes it hard because it's like, oh, you appear to have this specific disease and we think it's strange that you have it at your age, but we're going to just treat that. And then they don't think, well, is there a burden to my overall health right now? And does that make sense?
Yeah. So not necessarily autoimmune, but you could just be turning on poor genetic expression with inflammation, toxicity,
or even cancer, and various things. There's a rare type of cancer now associated with breast implants. It's a type of lymphoma. It's only seen in people with breast implants. And so they did a big recall on the textured implants, which is interesting because it's like, oh, that solved the problem. No. But the FDA also issued a statement around the same time as the recall saying that they wanted practitioners to be aware of this type of cancer in all types of implants, not just texture. So,
okay.
It's
all
hard,
right.
It's hard to say, but okay. So
yeah,
sometimes, it's going to be things like joint pain, swelling, fatigue, brain fog, hair loss, rashes, anything histamine related, gut issues. I mean, it's like it's everything.
yeah. Not to keep relating back to biological dentistry, but this is what's popping in my head is when like someone asking, how do I know if my root canal is a problem? It's kind of the similar thing. It's like, do you have any weird health symptoms that you feel like you've done all the things and it hasn't resolved? And that's like maybe the one thing that tips the bucket over.
Yeah. And sometimes the teeth, like, because they're following energy meridians in the body, like sometimes you can get lucky and it'll line up with your symptoms that you'll have dysfunction along the meridian for that tooth.
Yeah. What about the breast meridians? What meridians?
It hasn't really been like mapped and tracked in the same way the mouth has.
Okay.
So it's much harder. Also, it's not really the breast again. Like if I'm mobilizing microsilicone, okay, like if I had infiltration of pathogens in my saline implant, then that would be a case for this particular channel, right? But we're not, and this is like when I even had male doctors, like colleagues who were like in the early days just saying that they were going to evaluate like the woman's breasts to make sure they didn't have, and I was like, wait, what? Like you're not going to have like a green breast. Like it's not happening here. It's happening in the liver and the brain and the organs. Like you're moving toxins throughout the body. Does that make sense? So
yeah,
it's like a tooth is like a local infection, or right. That's like a local infection. There's a specific problem in that region. This is not an issue. This is not a local issue. This is a systemic issue, and it's caused by either, in most cases, mobilizing silicone from the chest to other areas and that causing a detox burden, or it's causing an immune reaction, which is going to affect your systemic immune system. The immune system is everywhere, right?
Right.
Well, everything, every issue is systemic, really. The oral stuff too. Yeah, you're going to be more trauma to the tooth, but
the oral stuff insofar as it's an immune burden, which could potentially fatigue the production of immune cells systemically, which can make you more susceptible to other infections. But it is different in the sense of it being like a local problem. Breast implant.
I mean, there's nerves, blood supply, energy meridians.
Yes, but breast implant illness is not happening locally in the chest. That's not where the illness is. The illness is in the organ systems, the detox systems, the brain, the nervous system, because we're talking about mobilization of chronic. It's the same as like what Renee was saying about a mercury amalgam. A mercury amalgam. Now, mercury might have a little bit of local inflammatory, just like your titanium is causing potentially local inflammation. But the problem of the mercury amalgam is not what it's doing right here in the mouth. It's what it's doing to your body, your whole body. Does that make sense?
Yeah, the systemic issue.
Yeah.
Yeah, I think we're saying the same thing.
Because you are
Yeah.
pulling mercury off the tooth and it's going into the whole body. So like if you chew gum or you drink hot liquids, it's just moving that mercury to other places, much like moving the silicone to other places is so that's why you guys are not sick and you're not having health problems, because in my perspective, from with the little bit I know, I think you have good capsule and everything is completely contained and it's like just perfect. Now, I did mention earlier, and maybe this is like confusing, that there could be like a physical block to your energy meridian, and that's it's more of an energetic concept. That's not a somatic concept. And that's just sort of like we're an organism, and that is not part of us. It's foreign to us. But insofar that you've integrated into yourself, maybe it's like a bionic arm at this point, and you're pushing energy through it. How could I say that's not the case, right? But
bionic boobs.
You removed them and you felt lighter and different, and you felt like you had more flow of your chi. Like that would be your anecdotal report, and I would love to know, but it's hard to know, right?
Yeah, it's hard to know. I think that's a big takeaway so far. It's hard to know.
So in the meantime, because we're not getting them out tomorrow, you have created this formula. I would love for you to talk about this because I think it's a great solution for those of us in the meantime. Talk more about that.
This formula, it's for people with breast implants or other silicone devices, and it's not for people who have breast implant illness. That's not who I made it for. I did make it with my understanding of what breast implant illness is and what kind of problems people might have with implants and how to support the body in those situations. So it's solving the problem of like the fear we discussed, and it's creating a solution where there's no solution exists currently. This is the only product in the space. Nobody really has so far understand implant illness enough to be able to correct for the problem. And we're finally publicly acknowledging it's a problem. So now we're in a new place where we can say, well, it could be a problem. What do you want to do? Do you still want them or not? And then if you want them or you have them and you're not ready to remove, and maybe you care about exposure to toxins. So what this does is it helps to support the collagen system, which we talked about is super important it could be important relating to a surgery, like an acute surgery where you need to heal your wounds before and after explant or after implant surgery, in creating really nice scar tissue capsule and supporting the capsule that you already have. And it also can help with systemic collagen. If you have laxity, that seems to be related to histamine derangement because it works in a unique way. I'm not giving collagen. I'm actually supporting the collagen pathway by dampening the histamine pathway, because histamine drains just collagen. So that's why, like in my, like the people who don't make good capsule collagen, remember earlier we said we were going to talk about why. So we'll get into that after. So collagen, scar tissue capsule. People have said, can this help with capsular contracture? I think so, because again, it's not like, because that's like a diagnosis, I think, but in the sense that capsular contracture, which is when it gets too thick, and usually it'll be thick in one part and thin in another, and it's like, it's deforming the implant. That's another collagen problem, right? Related to the system as well. So it also supports the body in the immune system's way. I have to be so careful with my claims because I can't prevent disease or it's very important for just supporting. But we know that when the body develops an autoimmune process, that there's usually a lack of substrates that recycle glutathione and also fat soluble vitamins that support the T regulatory system. Those are the immune cells that decide if like a tissue is foreign or not. So like if your body presents like a piece of your tissue and says, I think this is a pathogen, and then those T regulatory cells are out of whack because they're not supported, they might agree that it's a pathogen, and then you start making antibodies against your tissue. So that sleeve of the immune system, this supports that for balance. And then it also supports the detox pathways. It doesn't push detox at all. but it supports detox, and it also helps the body remove chemicals that act like estrogen, which is another problem. We didn't really talk about like mild symptoms relating to hormones, but that's also a thing with them. With anytime you have a high load of xenoestrogens, right? So it very much supports people who have exposure to chemicals, even if they don't have breast implants per se. I have people that take it that don't have breast implants because it's a really great like multivitamin for all of those things.
Yeah, I was thinking that it looks like a multivitamin with like the collagen, histamine support.
Yeah, and it has like all your fat soluble vitamins that you need, all the substrates that make and recycle glutathione. Glutathione is kind of a complicated topic. It's one of my favorite things to talk about, but like I personally, because and again, if you're ill, like if you have illness or you have chronic illness or you've had like, you need more of like bioindividual. This is not like
personalized,
right? But it is a like ongoing way that you can have peace of mind and support your body, and it's if you're like me, like if you look at my supplements, I have just like shelves and tiers, and this is like when I go on vacation, I just take this, but I mega dose a lot of these ingredients in my own, but I'm not healthy, like that healthy. So, or maybe I am now, but
yeah. Yeah, we have lots of shelves as well. So many supplements.
Yeah. So I think I answered all of what.
Yeah, that's great. Yeah, thank you for explaining that. I need to order some more
I
because
will
it's
send
definitely
you.
some peace of
No,
mind.
I'll
I
send
guess
you.
I'm just curious. I'm just
Oh,
looking through like the dosages, and for a multivitamin, some of the doses are quite low. So we could probably take this in addition.
Yeah, so you're right. Yeah, it's not really a substitute for a multivitamin completely, but it is like a way to get in a lot of the nutrients for those areas quickly and easily. I low dose them because if your doctor gives you, a lot of my friends supply this in their clinics. So if your doctor is giving this to you, they might tell you to take more. My recommended dose is 2 because I want it low dose because they're taking it for the life that they have the implant. So it's just a supplement.
got it. Yeah. Yeah.
Yeah, I like that.
And I also considered that if they're taking a multi, I didn't want to like overload. So I didn't want to like,
Yeah. That's always
Yeah.
the trick. It's like, how do we simplify the supplements? People are taking so many things and like, oh my gosh, we're playing chemist.
yeah. And then they're like,
Yeah.
just because since we're talking about dosing and whatnot, it's just also like I've had this conversation too where we're saying there's so much to the mind body, and I'm not saying it's placebo effect, but when you're supporting like these particular things, like that alone is powerful, right? So
Oh yeah.
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 No, I've been doing like affirmations about this because I think it's so important.
okay.
Yeah.
What is
all
the affirmation? Tell me.
Affirmations, like,
Specific one?
I love my boobs. They
Yeah.
have brought me confidence. They are not making me sick. My body has embraced them, like just like positive things about it.
See, that's so interesting. I have to like digest this because it's, and this is what
I
I
don't know
read.
if it does anything, but it feels good.
No, but just, just hearing where you're coming from, and like it hits me because I don't know that I would say I have regret, but I spent a lot of years just working in the fear zone of this, being in the fear zone. And I don't think that's the right approach anymore. I know it's like me being even judgmental about that is an issue, but my new line of formulas are going to be like all adjuncts to aesthetics, different things. So instead of this being even like from a business standpoint, this entire company is like a fear-based, I didn't intend it to be fear-based. It's just that at the time I was still in complex chronic illness when I made it, right? And that was my world. So as I shifted out of this, and I understand why like surgeons don't necessarily want to sell this because they're trying to be happy for people and give them implants, and it's a positive, like they don't want to have to be thinking about, and the patients still have to sign the FDA form now that talks about illness and cancer. They have to sign it just like along with surgery causes risks, you could die, right?
Yeah.
Then they just sort of like to tie it up with a bow, and they don't necessarily want to sell. And so the branding of this formula has previously been very serious. And I want to do a rebrand with all the new formulas that are like Botox support, liposuction support, surgery support, and maybe like a hair, skin, and nails, which is the only one that exists obviously already, but and have it be like a Biohack Your Beauty line, which is a lot less negative. It's a lot more just supportive and meeting people where they are. Because if you like, of course, like everything has risks. And if we go into it with this consciousness, I don't know that, right?
Yeah, no,
I
you're right.
appreciate
There
that.
is a lot of fear, but I think that just is synonymous with overwhelm sometimes, because the reality is we do need to educate on these things. People need to know this. Doesn't mean you have to go out and change, like turn your life upside down tomorrow, but we should understand the risks. But we also need to understand our own individual body. And so I work for Dr. Pompa now, who I know has had a big influence on you. And so
Yeah.
I talk to people every single day that are chronically ill. And it's like, I'm telling them they have to go to a biological dentist and get these things out. And you can just see their faces, but my job is not to overwhelm them. My job is
Right.
to support them and figure out like, what's the lowest hanging fruit. But
Totally.
sometimes like within that community, like I see it where people are like, no, this is like, there's no gray area. It's all bad. And I don't think that that's fair or true. I think it has to be personalized,
It does.
but still like educating in like in a positive and supportive way.
There's like, it's hard too, because there's obviously tons of people that have mystery illness that have been slipped through the cracks, and they're not educated like the way we are, right? So there's 100% a place for educating on all these things. Like if I didn't have all these types of like exposures, I never would have figured out what was wrong with me. So it's all super important. I feel like, we have to just stay in alignment and be really like grounded and focused on the parameters. And, it's easy too with marketing. Like it's tempting when we're in the health space and we want to attract a following to be like, oh, did you know about this bad thing? Did you know about this bad thing? Did you know about this? And it's just like, you gotta find.
Yeah. When I make reels, I'm always like, ooh, I'm sorry. Did you know that's toxic? Like it's going to be okay. But
yeah, but some people really go after the fear of it. You can see their whole Instagram page. It's like all fear based
because it gets clicks. It's entertaining.
No, and like Dr. Pompa, like his messaging and his story is so positive, and it's so like it's about empowerment, transformation, taking things into your own hands, and like that vibration is very much in the consciousness of everything he builds, and I feel that too. So yes, it's just like a personal accountability that I think we need to always be aware of, and I'm just super hyper aware of it. Maybe I'm overcorrecting just because I regret that I was part of that, but I guess it was unavoidable. It was part of my own journey. And I had to make a decision one day that chronic illness didn't just like lift off of me. Like I had to lift it off of myself. Cause after 10 years of dealing with it, and I had gotten so much better, obviously, than where I used to be, but it still wasn't lifted. And it was a consciousness shift that had to happen. It was a spiritual shift that had to happen. So yeah. So now I have to ask you, because I work with a lot of people with chronic illness, and I have to sometimes look at them and ask them if there's something about that circumstance that's serving them, and they have to really audit if there's a reward that they're getting on some level.
Of being sick, you mean?
Yes. It's a very important question.
It's like a very triggering question, because it sounds almost like you're blaming them, and you're not blaming them. But like we all have to like be accountable for if there's things in our lives that we don't like, why they still are happening. And you have to really figure out if there's anything that you're getting out of it. And there always is. There's always a payoff.
Yeah. Like you hate your job and now you don't have to go to work, or your kids are annoying you and now your husband's going to take care of the kids. Like it can be little things like that. And you just have to bring awareness to it, because some people just don't see that.
Yeah. I mean, yeah. So it's easier with local biohacking your beauty, because it's like, what am I insecure about? Why? How do I feel about this area? How do I feel about this area? Like what's going on with my face, my neck? Like, so it's more easier to just get in there and like approach all of our toxicity spiritually in layers, and not like, I don't want to overwhelm and be like, let's fix everything at once. Cause really like it's all layered anyway. And then once you lift and remove one thing and empower yourself, then something else comes. And then sometimes a bunch of negative feelings have a ringleader feeling. And when you get that one out, the other ones just go too. Right.
Oh yeah. I mean, trauma begets trauma. And if we're not looking, like our thoughts become proteins. So if we're not looking at that narrative that's being told, we could biohack all day long and take all the supplements, but it'll recycle itself in another form. So thank you for bringing that up. It's really important.
Yeah. Can I ask one more question before we wrap up? You mentioned maybe a supplement to support Botox. Because I think Botox is one thing, that even like biohackers do. And actually I saw this Instagram reel. This girl was like, going to the farmer's market with my bags and my glass water bottle and like getting my grass-fed meat and then going to get Botox. And so she was just kind of making the joke of like, some people like we do all the healthy things, but then we're still doing that. And there's no judgment. It looks amazing. So tell me about, are you trying to make a supplement that would then support
Yeah.
that? And I don't know the dangers of Botox. I'm not aware.
Yeah.
The
So
neurotoxin.
The neurotoxin.
Yeah, the Botox support formula would be looking at a lot of problems and also how to extend the life of Botox. But it's interesting because there's a new Daxify, which is like Botox, it's a new tox is what they call it.
Yeah.
And it's interesting because it has a peptide in it that helps it stay in the tight junction longer and it's less systemic. So instead of just putting it in and then it kind of goes into the bloodstream, it's interesting because I was a little nervous to try it because I thought, oh, it's stronger than, because people say it's stronger than Botox, but actually the technology, it keeps it in the local area. The peptide allows it to last a little bit longer. It doesn't actually like last longer in time sense, but it has a faster onset and it stays in that area better than Botox. So,
and it's not a
neurotoxin.
It is a neurotoxin. It's called Daxify, but it's not Botox. It's a different product than Botox. Botox is like a pharmaceutical. It's like that's the trade name for, there's a lot of. So we just call them now toxins. It's funny. In aesthetics, that's what they're calling them. They're just like, oh, like from our toxin category. There's a lot of brands, but they act differently. They have different structures, and Daxify is very interesting because it has a peptide, and it also causes a little bit of a glow to the skin. So we're innovating this space. Things that can happen when you inject, you can have viral outbreaks. There's concerns around the blood-brain barrier that is controversial, but like we know that the blood-brain barrier is hard to gauge like what's going on with it. So people have different levels of permeability, just like with the gut. So in those patients, sometimes that's a concern for neural inflammation. There's liver burden, like a short-term liver burden. And then there's other obvious risks. Like if you hit a nerve, you can cause, a droopy eye or laxity, but formula would be thinking about all of those things. And then liposuction support formula is very much a lymphatic support formula and so on. So it's really just taking like the world of integrative holistic medicine. Like if you gave these concerns to a functional medicine doctor, integrative medicine doctor, they would know how to correct it. They might give you a bunch of different things. But I want to put integrative medicine into med spas and into plastic surgeons' offices, because I know that those patients are just like the one you just described, the farmer's market, because this is like the modern person. We want to look our best, feel our best, have the best, do the best. And sometimes that is a compromise where we might take in a toxin because we want to look our best too. It's right. It's just like, what are your priorities? So it's so naive and ridiculous to say that we don't all feel like majority of people feel this way. And you don't take my, like, look at the stats on these aesthetic interventions. They're like billion-dollar verticals, all of them.
Yeah.
And so is wellness. Wellness is also like a massive vertical. So we're playing games with each other by saying that these are not intersecting. They are intersecting. So I just want to be upfront about it, create a safe space of non-judgment and bring people together and get these different types of clinics to talk to each other, which they're starting to do.
That's awesome. Well, thank you for your work and trying to bring that together. And I'm excited to see in the next 5 or 10 years where this conversation will be, with the new technology and research. It's like, it's going to be a given to be combined. So
it's super important that we are all open about problems that happen, because if we're not acknowledging the problem, we can't innovate it. And we all have the goal, like the good goals in mind, but that's where we've gotten hung up in the past, like with breast implants.
Yeah.
So,
Cool.
so could we plug Biohack Your Beauty event? Because I know that when this airs,
yes.
Tell us.
Yes, sure.
so we're doing the next Biohack Your Beauty event in Los Angeles on September 19th at the Americana in Glendale, which is a free public community event. And we also have a VIP ticket, which includes more like biohacking and beauty immersions and activations. And we'll have speakers throughout the whole day on like, I'm bringing in spirituality speakers this time to talk about like the mind, body, and the brain as a technology. And we're talking about aesthetics again, of course, and biohacking and integrative medicine. So
awesome. Okay. We'll definitely link to that in the show
share
notes.
the link.
So
Yeah.
yes. All right. Well, Dr. Kayte, one final question for you. Can you tell our audience what would be your number one piece of advice, something they could start doing today to optimize their health?
I just feel like
it's hard to pick one, but
no, I know exactly what it is, and it's not what you guys probably want. I would say that it's rare. Like, I think that our relationship with the creator is the most important relationship we have. And even like, I always mention Dr. Cowden because he's the one who taught me. He's a master at like all health things and retired now, but spirituality is at the top. So if you want to change, if you start with spirituality, you get the fastest results. So spirituality is our connection to the creator. Second to that would be energy. Third to that would be an emotional intervention, so like therapy, and then cell tissue, which is really what we're doing. Well, biohacking is more like neural integrative, but vitamins, stuff, cell tissue. So
yeah,
prayer.
that's great.
No, we
That's
wanted
great.
that.
Thank you.
Okay.
Yeah, yeah. I think we're gonna have Dr. Cowden on the podcast in a couple months. So
Really? No way.
yeah.
How did you connect with him? He's very like reclusive.
Oh, his assistant, someone reached out to us.
Maybe a different Cowden. Lee Cowden, the medical doctor who does like autism in the 90s. Same one.
Why do I want to say Thomas Cowden? Lyme
No,
guy.
no, Lee Cowden is a Lyme. He did all of the Lyme for Nutramedics. He has their whole Lyme kit. Is that who it is?
Now you're making me second guess.
Yeah, I don't know.
We'll keep posted on that. And you should.
Okay, stay tuned.
Yeah, like if possible. I don't know if he does this type of stuff, but I think he would maybe. So you should try to get him. He's so good with like Lyme, and he actually treated some of the original breast implant illness patients in the 90s, which is how I connected with him. We started on that topic because he created a proprietary system where they were able to push the silicone out of the gut associated lymphoid tissue and bypass the heart through the gut. So because all the silicone was getting like jammed, because this was like a lot of big silicone back then. And so trying to pump that silicone into the thoracic duct, it just wasn't happening. So they did this really interesting system at a retreat, and they were able to get a lot of silicone out of people, and just it would go into the bowels instead of going through the cisterna chyli. Yeah. Or
wow.
Rather. Sorry.
Wow. That's wild. Cool. Well, thank you for all of this. This has been so fun.
Yes, thank you.
Can you share with our audience the best places to follow you, find your products, learn more about you?
Yeah, so you can go to siliconesupportformula.com or drkaytes.com with an S. And my Instagram is at DRKAYTE.
Great. And we'll link to that in the show notes.
Of your name.
Yeah.
Yeah.
Thank you so much. This was so fun. And luckily I didn't fall asleep with that Kin drink.
It wasn't the biohack fail. Now you know.
Just down regulating.
Not with
sleepy time.
Lion's mane. And what is this? This is iodine. So.
Nice. All the
biohacks.
energizers.
You're good.
Amazing.
Well, thank you so much for all of your wisdom, and it was so wonderful chatting with you. We're so grateful.
You too. Thank you guys.
And we'll see you soon, either some point in LA, either Biohack Your Beauty or Healthspan Summit. So can't wait.
Yeah, absolutely.
All right. Thanks to everyone that tuned in today. We will see you next time.